So the dogs arriving today have been rescued from a meat farm. They're like death camps, really, when these dogs are basically tortured and killed, and it's horrendous.
It's very clear the damage that has been done by these dogs being in the environments that they've been in back in Korea. These dogs have had no upbringing, no socialisation, no training, no fun, no joy, and as a result, they just have nothing to give. Today, I'm on my way to North London to do something that's really important to me. The rescue charity All Dogs Matter have asked me to come and visit their kennels to check out some new arrivals.
Waiting at All Dogs Matter is Ira, who founded the rescue charity.
Hey, Ira, how are you? Good to see you.
Yeah, you too.
Big day.
Like the jumpsuit.
Oh, thank you very much. Well, I'm kitted out, ready to go for a very big day. I hope our Korean dogs have travelled well to the UK.
Yeah, it was very exciting. Just waiting for them to arrive.
Kennels have been especially prepared for 12 very special rescue cases that are arriving all the way from South Korea.
So the dogs arriving today have been rescued from a meat farm. They are dogs that are either bred for their meat, or they're often stolen, or they're ex-pets that have been picked up. They're kept on these farms, fattened up, and then once a year there's the Yulin meat festivals, when these dogs are basically tortured and killed, and it's horrendous. They're like death camps, really. The Korean government and lots of, young Koreans are obviously anti this now. They're working at closing most of these farms down and rescuing and taking out most of these dogs.
Dogs are complex, emotional, sentient beings, so they understand what's going on around them. So the thought that these poor animals live a life where they're unloved, and when it comes to their final moments, they see what's going to happen to them. It's just, you just can't bear thinking about it. It's awful.
These will be the first Korean meat trade dogs to arrive in the UK after being rescued by the charity Humane Society International.
So we're looking quite shy, a little bit traumatised. Hello.
London-based All Dogs Matter has been entrusted with finding them new homes.
To be able to make just even the slightest bit of difference and have a connection that makes them think, you know what, maybe people aren't horrendous, which they must think right now.
Hello, buddy. Welcome to Britain.
And I hope that these dogs might finally see a good side to people.
It's just awful to think this is the first time he's been shown true affection, isn't it?
Well, absolutely. I mean, the trust that they give, considering how they're treated, is just, well, I think maybe we can learn some lessons from them.
Well, let's get you somewhere nice and warm, shall we? We've got a lovely bed set up for you. My job today is to examine them all, make sure that they have survived the journey okay, and they're given their first set of vaccinations.
Each dog is taking to its environment differently. While some seem relaxed, others are a lot more fearful.
She won't bite. Poor Lulu, she's obviously seen a hell of a lot. She's one of the most nervous. She's petrified. She won't make any eye contact, won't look at you. She just doesn't want to see anything of the world. I mean, just wonder what she's seen in her little life.
It's so upsetting to see, isn't it?
It's more upsetting now I've met them.
It's really got to you, hasn't it?
Yeah, now I've met them. Yeah.
It's very clear the damage that has been done by these dogs being in the environments that they've been in back in Korea. These dogs have had no upbringing, no socialisation, no training, no fun, no joy, and as a result, they just have nothing to give.
She's completely broken down. She's just frozen.
Lulu is clearly severely traumatized. What's going to be the hard part is teaching this beautiful dog to be a dog again. We do need to take a different approach when trying to examine dogs like this, because you simply have no history, and if anything, you know that they're from pretty bad beginnings. So they're going to be nervous, some of them fearful, some of them aggressive as a result of being fearful. So it is a case of just gently moving forward, doing the best for them, but trying to appreciate the traumas they've been through. A little feeling of what freedom feels like, hey, sweetie.
She's so sweet.
Abby is the first dog Scott will be treating.
The funny thing about dealing with Abby is just she's actually quite friendly. Yes, she's timid and she's nervous and she's shy, but she's not aggressive. And you think, you know what, after what they've been through, if they were trying to bite my face off, I'd understand it. But yet she's still got room in her heart for affection, which is just so desperately sweet.
A little bit unsure of noises.
Well, I suppose in her past, those sorts of noises could have meant death. To think they might have actually seen...
Being grabbed out
Yeah.
of the cage. We're sitting here now, someone
Yeah.
can come in and grab her out.
And kill her right in front of the
others.
companions.
It's not worth thinking about. But sadly, it's a reality and it's happening. We just need to stop it happening.
Yeah. And for this little girl, she just needs to learn that she can be safe and confident here and no one's going to do that to you.
It is a real privilege today to be the vet for these dogs.
Okay, Abby, so you're going to be a brave girl.
The first vet in the UK to examine them, give them a vaccination, and then help them on their way.
Hey, that's the first step to your forever home. Yes.
I was really gearing myself up for a really difficult job today, that these dogs would really make it hard to get these vaccinations in them to start the process of a healthy new life.
Good girl.
Good girl.
But most of them, friendly, sweet, just thoroughly gorgeous creatures.
So little Mocha here is behaving a little bit more like what you'd expect from
I
a
think
meat
so,
dog.
yeah.
A bit more
Nervous
aggressive
and a little bit of an aggression, yeah. So I
Yeah.
think we're going to have to be careful here.
Getting into the cage with Mocha and Jane, you can see that this dog is just quite fearful, quite nervous, and also a little bit reactive. And it's those dogs you can't read very well, and sometimes they go from fearful to aggressive.
All right. You're not stupid. You know exactly what this is, don't you? I mean, he's acting just like you'd expect a dog from a meat farm to behave. He's like, all people are scum,
Yeah.
and I don't trust one single one of you. Hey?
Understandably, that type of rope would have been the kind of thing that would have been put around other dogs that he would have seen back in Korea and would have been dragged out to their deaths. So clearly he's going to be worried about that.
Good boy.
Now, we're really sorry about that.
Good
Okay?
boy.
We're not trying to do anything mean to you. No, we're not. No, we're not. Okay, so I'm just checking the fact that Mocha is definitely a boy.
And?
He is, but he's got a bit of an issue in that he only has one descended testicle.
Okay.
So he's a cryptorchid. So the other one, I can't feel it in the inguinal canal. So it means that that testicle is likely still in his abdomen. So when he gets neutered, we'll have to go fishing in there to try and find
it.
Remove it.
Good boy.
Although I've picked up a condition in Mocha that does need surgery, I just don't feel that his emotional state is strong enough for him to leave the supportive environment of the kennels. So I think it's best I leave him here in the caring and loving arms of Jane, but I will be coming back to pick him up soon.
See, we didn't even need the muzzle. Hey? No, we didn't. No. Right, so who's next?
Most of the new arrivals are Jindos, originally bred in South Korea for hunting. So the next patient kennel manager Jane introduces to Scott
Hello, Jack.
stands out.
Hello, mate. Wow, well, that's a very friendly hello, isn't it?
Good boy. Should we go in and have a look at him?
Yeah, please. Hi, Jack.
Jack is a very sweet little beagle cross. He's very chilled, very happy, very waggy-tailed dog. He's clearly an ex-pet dog that unfortunately got caught up in the dog meat trade.
So I had noticed with his left eye. I'd like you
Yes.
to have a look at that, please.
Yeah, I can see. So he's got a cherry eye, an enlargement of the gland that hides in the third eyelid. It's prolapsed out, becomes more irritated, gets larger, stays out. So it's probably very likely that Jack has had that his whole life, and something I can easily fix with a little bit of surgery, can't I?
Brilliant.
Yeah, but I can see also at the same time he's probably... Are you an entire male? Yes. Sorry to do that straight away. A bit rude, isn't it? Hey? So we need to neuter you. We need to sort your eye out. And then we can find you a lovely new home. But he is not going to have any trouble,
I don't think
is he?
so. I think he'll be straight out.
Yeah.
Jack's a really happy boy and far less traumatized than some of the others.
All right, good boy, brave boy.
So I think he's the perfect candidate for me to take back to the practice to give him all the procedures that he needs so he's ready for his forever home.
Where's my good, brave girl?
Before Scott heads back to Richmond with Jack, there's one last rescue dog to look at.
Lily just has no spark in her at all. There's no energy, there's not even any fight.
I can hear a heart. Now we just need to fill it with some love, don't we? Yes. Okay, good girl. So now I need to vaccinate you. I'm so sorry.
It is literally like having a soft toy that you need to vaccinate. She just doesn't react. She is just given up.
She just doesn't know what it's like to be a dog, doesn't know what it's like to enjoy life, to be outside, to be loved, to be cared for, to be trained, to be fed. Just feel like you need to cuddle her for years and years to make up for everything that's been done to her, everything she's seen. We're sorry. It's gonna get better. Yeah, well.
Rosa was picked up by the dog warden after being found wandering the streets of London.
Hello, gorgeous. So yet again, another stray Staffie, hey? Very overrepresented breed, aren't they?
Unfortunately, it's very common with Staffies. Most of the dogs that come into rescues are Staffies or Staffie types.
I think Staffies get dumped so often in rescue centres because the people that think that's a perfect dog for them are not getting them for all the right reasons. People should want a dog for the companionship, for the love and the affection that the dog gives. But some Staffie owners see them as literally a status symbol. They haven't thought about all the welfare needs that this dog has, and very quickly they realise that they can't keep the dog. They then throw it into a rescue centre, and that's where they languish.
She's very, very happy.
Yeah, well, they're very, very thin. Look at all those ribs, Rosa, hey? You need some feeding up, don't you, my love? Hey?
I don't understand people that can dump their dogs. I can't get my head around it at all. Rehome it the proper way. There's people around to help these days. You don't need to abandon your dogs.
Hey, look at you. Aren't you just lovely?
Oh, lovely Staffie smile.
Look at that big smile you've got, hey?
She's quite a happy little girl. Just hoping that we can get her a perfect family.
But first, Scott is giving Rosa a total health check. Apart from being underweight and suffering superficial skin problems, Scott soon discovers a far more worrying issue.
There's actually some hard lumps present along the strip of mammary tissue here. Can you feel those?
Oh, God, yeah. I can really feel really hard lump.
Yeah. So basically, she's got lumps in her breast, which, for any female is concerning. It's not something that we can just quickly remove and go, oh, yes, that will be absolutely fine. We need to look into this, understanding what kind of lumps they are and whether they'll affect her future.
Okay.
Scott is guessing that Rosa is about 8 years old. It appears she has been used for excessive breeding before being dumped.
Overbreeding is fairly common in Staffies, unfortunately. They are bred by unscrupulous breeders. They are bred every single season, so that means every 6 months, these poor dogs can be having yet another litter of puppies.
So I think what we're going to have to do is take you to Leafy Richmond, check her over and see how she's going, and make sure that she is going to have her forever home.
Oh, thank you. Hey. Rosa's going to make a perfect pet for somebody. I love her. Really love her. I'd love to take her home myself.
Yeah, that's a killer. That's a killer of a dog, isn't it?
Goodbye kiss.
Oh.
See you soon.
So do you want to come back to Richmond with me? Hey, beautiful Leafy Richmond? Hey, or do you want to crawl back to Richmond?
I think she does.
Crawling back to Richmond's a bit of a distance. Come this way. Come on, Rosa. Let's go meet the team, shall we? Oh, you're keen. Come here.
Scott's arrived back in Richmond with little rescue dog Rosa.
Hi, Rosa.
The friendly Staffie is an instant hit with receptionist Kirsty.
Kirsty, a kiss. Hey.
Sit on my lap. You comfortable? Oh, you're lovely, aren't you?
She's beautiful.
You're so friendly.
I know. All right, well, let's get you off Auntie Kirsty's lap, hey, and go and check out those lumps. Come on, Rosa.
Oh, bye, Rosa.
Good girl.
Scott's concerned about lumps in Rosa's mammary glands and plans to remove one so it can be tested.
Hey, so this is Rosa. Oh,
Rosa.
Good girl. Gorgeous.
Oh, hello.
Full of energy, eh?
Hi.
Assisting Scott are head nurse Emma and newly graduated vet Riaz.
She is clearly a dog that's been bred a lot.
Oh, honey. I definitely feel it on my heartstrings when a neglect case comes in. Having animals myself and being such a big animal lover and doing what I do, I just can't put myself in the mindset of other people and how they could want to harm them.
Unfortunately, there's absolutely no history. She was just found roaming around and was brought into the rescue centre.
You must have had an owner at some point, surely.
All right, guys, well, I'll leave you to get her ready for surgery and I'll be down in just a sec and we'll get cracking.
Yeah?
Good stuff.
This is Riaz's first job out of university, and already he's discovering plenty of challenges.
I'm not really used to seeing rescue dogs because the way that we've been taught is to always get a good history and take it from there.
What a brave girl.
But when it's a case like Rosie, you just have to sort of do the best you can and, you know, put the animal's needs first.
Time to go to sleep, baby. Good girl.
We're good to go. All right. So the big concern for this little lady is these mammary masses. And we can feel them running up these chains of teats. And unfortunately, now she's knocked out, I can even feel one at this top one. To remove all of them is a massive surgery for her to undergo, and we don't want to put her through that unless we absolutely have to. So what I think we need to do is just take just one of them away, and at the same time, we'll then spay her. And what that will do, of course, is reduce the stimulation to the area.
The hormonal
Exactly,
stimulation.
yeah. And as a result, hopefully cool down the growth of these masses, whatever they turn out to be.
Okay. And the most striking thing that we found was the number of masses. Normally, you might find one or two at a dog which is that age, which hasn't been spayed. But to find the sort of number that we did, it was quite striking.
Everyone ready to go? Okay. Yes. All right, so we just need to keep our wits about us.
Scott is carrying out the spaying on Rosa first.
Actually, her being quite skinny is quite useful, actually. It's quite easy to see what we need to see.
The spaying is routine.
Okay, I'm happy with that.
And Scott can now move on to the lump removal.
I should be able to remove that fairly easily, and actually I'm going to do it through the incision line I've already made for the spay. So I'm just going to incise over it now, kind of pop it out like a pea out of a pod. It's not very pretty, it's not very nice.
But now that he can see the lump, Scott is starting to worry that this part of Rosa's surgery isn't going to be as straightforward as he'd hoped.
Although it feels like it should just pop out, it's very tightly adhered to the tissue surrounding it. So it's very angry looking, very nodular, very hard. It worries me, I've got to be honest. It just doesn't look good. All right, Riaz, what I need you to do for me is just pop your 2 fingers underneath and around it, put a little bit of pressure against it for me. I'm not that happy, if I'm honest, because I was really hoping that it would just be relatively innocuous looking, hard white ball that was just going to pop out and look very, very innocent. But in fact, what I've found is something that looks quite aggressive, just nasty. Okay, all right, there we go. So now we've taken this little bit of tissue out and the lump. What we're going to do is then send it off to the lab. I really don't know what it is right now. It absolutely could be cancer. Oh, that's you get. Good girl. Well done.
So there's sort of 2 types of tumours. The 2 types that Rosa's could come back as are either benign or malignant. The benign ones don't really spread and do too much damage unless they get really big. The malignant ones have the ability to spread to other tissues and sort of do damage elsewhere, which could compromise Rosa's life.
Oh, good puppy. This is normally the time we call an owner, but sadly, you don't have one. So I'm just going to have to take on that role for a while, hey?
I think while Rosa is here in recovery, she is going to get all the love in the world. The nurses have all fallen in love with her, and already they're dying to go in and give her a cuddle once she's recovered fully.
Hey, poor baby. I think we're just going to keep Rosa close by until we can understand what's going on and what we need to do to try and save this beautiful dog. Poor Bubba. Yeah, I love you too. How's she going, girls?
Hi. She's, yeah, she's very, very flat.
Rescue dog Rosa has taken a sudden turn for the worse. The pathology results are back from the suspicious lump that Scott removed from Rosa's breast tissue.
All right, there we go.
And they show that, as feared, it is cancer.
You love a good kiss and a cuddle, don't you? Hmm? Yeah, you do. Yeah, you do. Rosa, our beautiful Staffordshire Bull Terrier, is really not doing too well today. She is flat. Emma's been working with her all through the morning.
It's not how it was supposed to be, is it? It's not what we talked about.
With Rosa deteriorating so quickly from the rapidly spreading cancer cells, Scott has taken new x-rays.
Sadly, down the bottom here, there is this, and that looks like to be chest met, which is a metastases, which means that the tumours that are present in her breast tissue have spread to her lungs, which is gutting because it means that no surgery in the world is going to save Rosa. It makes me so angry that someone knew that this dog had those lumps there and simply did nothing about it, because if they did do something about it, then Rosa's life could have been saved, and that is just awful.
Hey, beautiful one. Hey, I bet you were a gorgeous little puppy.
Head nurse Emma and receptionist Kirsty are maintaining a vigil at Rosa's side.
You've become such a big part of the family. Everyone has just fallen in love with her, haven't they?
Especially me. I feel really devastated, to be quite honest. You know, I've come to get really quite attached to Rosa and, you know, considering adopting her myself, and it's absolutely heartbreaking.
Tough decisions will soon have to be made to ensure Rosa doesn't suffer.
I think the most important thing that we always have to remember is doing it for her.
Yeah, definitely.
I don't think this part of the job ever gets any easier. I think it always hurts. And I think the day that it stops, I'm not doing my job right.
Soon after, Rosa lost her battle. But she leaves a lasting memory.
Look at that big smile you've got, hey? Rosa signifies what we all love about dogs, the fact that she gives unconditional love.
Oh, good girl.
Regardless of her history and what's happened before, she loved us. And I hope that we've given her a little window into how normal dogs live, which is where they're loved. How's it going? You all right?
Just a little bit nervous of new people still, but...
Yeah, and very noisy baby. Okay. It's very sad, but this poor little girl has come from a puppy farm, which doesn't surprise me because I can see her abdomen is quite baggy. It's clear that this very young dog has had multiple litters, and it's also very much at the hands of someone who's incredibly unscrupulous. It really is a travesty.
It's really sad to see her in like such a bad condition, obviously, and she was much skinnier and had a lot less hair when she first came in as well. Luckily for Ethel and her sister and a few other dogs, they found their way to All Dogs Matter to find new homes. It was clear that she was in the worst condition with the mange and being so severely underweight. So she came straight into foster care with me.
Ethel really isn't the picture of health. She's very thin, so she's probably had a very poor diet, but also her skin is really bad. And also it's very patchy where the hair has fallen out as a result of a mange mite infection. Well, it looks like you've got the mites under control, which is great. You can see some new hair growth growing back, but that's not her biggest issue, which I can now hear.
Yes, I say when you come closer, exactly, that's the first thing you sort of notice about her is that it's like sort of grunty snort. But she really does struggle, and it sounds awful, even though maybe she doesn't show us that, you know, it is maybe difficult for her.
So at rest, she makes this much noise.
Yeah, her body shakes, and she sort of really seems to be struggling to just breathe normally.
Yeah, well, it's one of the occupational hazards of looking like that. When you don't have a nose and you don't have much of a nostril either, do you, sweetie? It means that you can't get enough air in. Can I have a listen to your chest first, Mrs. Thankfully, her heart sounds nice and clear, doesn't it, sweetie? But that's after I take into account all the huge amount of noise that's coming from up here. It's like she's snoring while she's awake, which is clearly not normal. There is a real rise in the popularity of flat-faced dogs. Therefore, a lot of dog-owning public and people that see them on the street go, oh, it's normal for them to make that much noise, and it really isn't. And certainly in Ethel's case, any point when she's at exercise, she's going to struggle to get the amount of oxygen she needs into her system, and that can mean that it can become life-threatening. So basically what I think we're going to need to do is to give her an anaesthetic back at the practice in Richmond, look down the back of her throat and likely find an elongated soft palate.
So it's almost like a blockage, sort of, so she can't fully breathe in or fully breathe.
And every time she does, it sort of
catches.
Flaps away, it catches, it goes into the trachea, the windpipe as well, which is one of the reasons why she's making so much noise, and potentially trim that. And alongside that also, you can see how her nostrils are almost little slits. What we need to do is just open them up, and those two procedures together will hopefully increase the amount of oxygen she takes in with each breath and reduce some of the sort of reverberation that you can hear.
It's a lot easier for her.
And make it much easier for her to breathe. Hey, sweetheart.
Well, we're really so lucky that there is a procedure that can help Ethel, because it will make a huge difference to her life, especially when she goes on to a new home where hopefully, she'll have some dog friends to play with. And if she can, run around and act like, a dog should, then it will make all the difference for her life in the long run.
Not only are you a princess living with Rowena, getting consultations in the park, but now you're going to have a nose job as your first veterinary procedure.
Get your nostrils done, lucky girl.
Yes, but all for a very good cause. This is Ethel.
Oh, she's really cute.
Wow, she's in pretty terrible condition, isn't she?
Bit of a scabby genetic mess, aren't you, darling?
Back in Richmond, Scott is introducing rescue dog Ethel to nurses Reagan and Sam.
It won't be a surprise to you to know that she's come from the puppy farming trade. She and a few others were rescued.
The 3-year-old pug cross is suffering from severe breathing problems caused by genetic abnormalities.
I can't believe this is still happening, really. And when we know so much about it and people are still putting money into this industry, it's just crazy.
So I'll leave you guys to get you ready for surgery. I'll go get changed, all right?
Cool.
See you in a sec.
Ethel as a case just really upsets me. Why was she ever bred in the first place? Because the condition that she's suffering with is genetically inherited. She's suffering, so why would you spread that suffering to other puppies?
Let's give her the anaesthetic and start having a look down the back of her throat.
Because Ethel is a pug-type breed, a brachycephalic or flat-faced dog, she doesn't have much of a nose, and so a lot of the structures that are present at the back of the nose in a longer faced dog are shunted into the back of the throat. And what you can clearly see now that Ethel's on the table is that her soft palate is sort of flapping in the breeze like a curtain in an open window and going right down and into the larynx. That means that every breath she takes, she will sort of swallow that part of her soft palate, and that leads to that incredible noise.
So as soon as we tube her, you'll find this noise will go away. And there, the sound of silence. Okay, good girl. So let's get her next door and get started.
The procedure I'm about to perform on Ethel is basically the shortening of the soft palate, but also performing a alarplasty, which is basically widening of the nostrils.
So what I need is for you to hold the soft palate out the way. So I'm going to place 2 stay sutures in. You hold these 2 sutures and then you can lean on me for support. And I'll then trim the soft palate accordingly.
Cool.
Get you to on either side.
Yep.
Like that, that's it. So there's the soft palate, that's the bit that's going down our little girl's throat, and that's the bit that I need to trim. If you give that quite a bit of tension, you have to put your elbows on my shoulders, it's absolutely fine.
Okay.
There we go. Oof. A bit of disgusting smelling smoke, and that's a very chunky piece of soft palate. What you can see is by removing that flap, you've now got an open airway, because you can see that that is basically like trimming the curtain, so the curtain's not going down the window anymore. The window is nice and open. You're getting lovely airflow. So I'm just going to oversew that. If you just release now, and we'll have a little look.
Wow, that really is such a difference.
Yeah, actually you can see a larynx.
Yeah.
Good, okay, so that's part 1. So now we're going to do something called an alarplasty, which is changing the shape of the nostrils. In this case, I'm doing that in order to increase the nostril size and therefore get more airflow going into her nostrils, more oxygen, therefore she should be able to breathe quieter and exercise better. See how much that's opened up? Here we go. There is Ethel's new nose.
Ethel's new nose.
And not a bad looking one at that.
It's a lot bigger, isn't it?
Yeah. All right. Let's wake this girl up. Oh, good girl. Good girl. Hello, baby. Hello. Guinness Book of Records for that tongue. Look at that. You can lick your own forehead. Like, that's incredible. But listen to you. I
Can't hear anything.
Exactly, that's my point. Yeah.
What's incredible about this particular procedure is that literally straight after the surgery, you will see, or rather hear, a massive difference. And this dog should hopefully breathe a lot quieter and a lot easier.
Have a little nap, start organising that spa treatment, yeah? Lovely bath for you, I think. Yes, before you head off. Good girl.
You doing well?
In Richmond, rescue pug cross Ethel is recovering well from her throat and nose surgery to correct her noisy breathing.
Come on then, let's get you bathed. There's a good girl. Hey? Here you go. Here you go.
Oh, you are here. I couldn't hear you.
Nurse Jess and practice manager Maz are now going to give the little rescue dog some much-needed TLC.
Is that nice?
Is it? Oh, thanks.
Ethel's responding really well to all the affection and attention. I think she's really coming round to us all and getting used to a better life compared to what she came from.
You better get used to these, because once you get out and about in the park, bet you're one who's gonna run in the mud. Aren't you? You're gonna find the muddiest puddle. We thought it'd be really nice to give her a little treat, a little bath, smell a bit nicer, make her fresh and beautiful, all ready for her new forever home that she's getting to go to. There we go. Oh, that's all right, see?
It's nice, see?
Upstairs, Ethel's foster carer Rowena has arrived to collect her.
Yeah, I'm so excited to get her home. Not only for us, we get to see how she is and, play at home and see how she's doing, but I'm very excited to meet her new potential home, and hopefully they'll be taking her soon.
Hello, here she is.
Hello, little one. She's like, who are you? I can barely recognise you with your new face. Oh, no. Hello.
So she's done so well since the surgery. Not only has it made a massive difference, as you can hear, to her breathing, and that she's not making hardly any noise now, which is wonderful, but also transformation in her personality. Like, she's really come out of a shell.
Really?
Just
That's amazing
being with
to
us for
hear.
such a short period of time, and you're really getting a bit waggier and a bit happier, and certainly breathing better. So
That's so good
emotional
to
and
hear.
physical results. So yeah.
Well done, Ethel, and well done, all of you.
I really feel today is the start of a new chapter for Ethel. She's had a terrible start in life. It's literally had her puppyhood robbed from her. She hasn't had access to the great outdoors. She hasn't had medical treatment. She hasn't had love. And now we've been able to treat all of those particular issues and work on her shyness and her emotional side. And hopefully now she'll be a happy, healthy, well-adjusted dog that can go off and enjoy life.
I couldn't do anything about the tongue, however, because she has a massive tongue and a tiny mouth, so she'll always have her little tongue tip, won't you, sweetie? But hopefully now everything is as good as it can be for her to find a new home.
It's amazing. That's so exciting. I'm sure she's very excited too. Probably don't realise it now.
All right.
You're not going to want to leave.
Bye, Ethel. See you later, Rowena.
Thank
Take
you so
care.
much.
Bye.
Thank you. Bye-bye.
Bye, girls.
Hello.
Hello, you four.
Waiting for Scott is animal rescuer Sonia.
Hello.
Hi, baby.
Hello, you.
And the 4 new arrivals that were all saved from a local pound that could no longer house them.
They all look horrific, don't they? Their fur is in patches and tatty or even non-existent on that little pom. Do you think we need to have a little look at her and see what's going on? It was very clear from the get-go that the Pomeranian was the one that was struggling the most. She's the one that's lost the most amount of fur. She looks in the worst condition. She's very thin. She's struggling. I can see, well, clearly the biggest problem here is her skin and the complete lack of hair. So this has been going on for a while. She's lost a huge amount of fur as a result. Who would let their dog turn into this?
Get into
I mean,
this
it's
state.
disgusting. It really shocks me to the core, and to see a Pomeranian look like that, I just don't know how the people here do it, and I don't know how their hearts don't break every day.
She's also coming pregnant.
Oh, you're joking.
So, yeah.
And what happened to the puppy?
The puppy didn't survive. The puppy wasn't even a proper pup, so it wasn't even fully formed. And so,
Sickening, isn't it? Really upsets you, doesn't it,
Yeah.
to see this?
it's heartbreaking. Everyone gets upset. You can't help it. You wouldn't be human if you didn't get upset about something like that. Sorry.
You're okay. We're going to sort you out. Hey, don't we? Can we sort you out? Hey. It's all right. Oh, hello. Hello.
Wow, they're affectionate little ones, aren't they?
Come on.
All right, well, what I think we need to do is, all these guys look like their conditions are quite manageable, but this little one clearly needs my help.
Scott will now take the malnourished Pomeranian back to his Richmond practice.
There you go.
To find out just what is causing her dramatic hair loss.
She's really stolen my heart, this little one.
Say goodbye to Sonia.
Bye-bye, darling.
We all get quite attached to the dogs down here. We might only spend a few days with them, but we love them all, as if they're our own, really. Okay.
I never understand how people can be cruel to animals. They're defenseless, innocent creatures. Why would you be mean to them? Why would you hurt them or neglect them? I just don't get it.
Scott has arrived at the Richmond practice with the shockingly malnourished rescue dog that he's decided to name Kylie.
What's the matter with her?
Well, it's a long list of ailments that little Kylie's got going on, I'm afraid.
It's so sad. You're in good hands now, little one.
But the pint-sized Pomeranian is not the only special guest making an appearance today. Recently graduated vet Riaz is on his way to the practice for day one of his new career.
I've been working for this for the last 5 years, and now I can't wait to just get stuck in.
Hey, Riaz.
Hey, Scott. How you doing, mate?
I'm good, mate. How are you?
The rookie will be spending a 4-week placement at Scott's practices.
5 years.
So, and here's our consult room. And it's Emma.
Hello.
This is our head nurse, Emma.
Hi.
Nice to meet you.
Riaz, new grad, fresh off the press.
How fresh are we talking?
Oh, too fresh.
Yeah, as in like a day fresh.
Oh.
Yeah.
Like yesterday.
I'm glad the first person you met at the practice is our head nurse, because I would say, as a new grad, the person that you want to be besties with is definitely the head nurse.
So, head vet, but you call the shots.
Yes. Yes, I do.
Yeah.
I'm glad we've established this hierarchy on day one. Get it right from the offset.
From the very beginning. So,
Brilliant.
you, Scrubs, you downstairs, and I'll bring the dog.
What Riaz doesn't know is just how shocking his first case will be.
I thought today that Kylie would really help to flex Riaz's veterinary muscles. So guys, meet Kylie.
Oh my God.
A baptism of fire to try and understand everything that's going wrong with this dog and what we can do to help her.
Right, well, let's get started then. Look how much hair she's lost. You can see right through to her skin, and you shouldn't really be able to do that at all.
We have virtually no history on this dog whatsoever, so we have to piece it together ourselves.
When Scott told me there was no history, it was literally like a nightmare. I was like, oh, can't I just have an easy vaccination or something to do? But I'm happy to do that, so bring it on.
We're going to start at the front of you, little girl, and work our way back, eh? Here, a little look inside. Oh, darling, you're missing quite a few teeth as well, aren't you? Skin's quite darker as well in patches. She must be really itchy. This is clearly something that's just, not happened overnight.
I've never seen anything like Kylie. I think she's the first and hopefully the last time I ever see anything like that.
I mean, just looking at her tummy and her mammary glands here, she's clearly had puppies.
Well, you'll be horrified to know that just 2 days ago, she had a stillbirth at the kennels.
She didn't, okay.
Yeah.
Wow.
Oh.
Yeah.
It's not fair, is it? When I heard that she'd lost a puppy, I lost it myself. I broke down. I don't know if it's a maternal feeling, woman to woman, but the thought of losing your baby in a stillbirth, it just made me feel for her. It's just not fair.
So, Dr. Riaz, what do you think?
I think what we should find out first is the skin problem, whether it is a simple skin problem, whether it's just a parasite or something like that, or there's an underlying cause perhaps. I think we should start with some skin scrapes.
Riaz is now carefully scraping away the top layer of Kylie's skin, trying to find evidence of the mites that are making her life a misery.
Lovely. That's great. Good work. Good job. Good girl, honey.
But the mites are notoriously elusive and can easily go undetected even under a microscope.
All
Where are you little blighters? They're gonna be in here somewhere. So guys, no mites found on this microscope slide. So what are we gonna think about that?
The fact that we haven't found it doesn't rule it out. So I think what we should do in the meantime is start treating for the mites and perhaps run an additional test to confirm the presence of it, something like a blood test.
Samples of Kylie's blood will now be sent away to the lab to confirm the team's clinical diagnosis.
It seems to us that the biggest likelihood is that Kylie is suffering with mange, and the best way to kill off a mange mite is by giving the dog a bath and start helping Kylie to recover and grow that fur back. Now you've got to give a dog a bath. A very technical job.
I'm very qualified for it. Let's do it.
Hi, honey. Are we ready for your bath?
Oh.
I know.
Here she is, the star of the show. I never saw her on my first day of being a vet. I'd end the day by bathing a Pomeranian. There you go.
Don't say.
Here you go.
We don't know yet if we're treating for which type of mange, so we're just gonna hit it hard. So we're just gonna not get her face too much. This bath is not the nicest thing. We're dressed up in masks and gloves because it's pretty strong stuff, and poor girl has just stood there taking it. So what we'll do with the rest of it is just sponge it on a little bit.
You get free tummy rubs. Hey? Hey, gorgeous. The way this works is it will kill the bugs from the outside and hopefully make her feel a lot less itchy, and she can start to grow some of this hair back. If it is just some bugs on the surface, then we should start seeing some progress in the next few weeks with regards to her hair coming back. I never thought that I'd get such an interesting and a bit bizarre case as I have today.
And with me, your first nurse.
That's true. How does it feel to take... No, I can't say that.
Your nursing virginity. I can't wait to see her full of hair again. I bet she's gorgeous.
Riaz is just relieved all of Kylie's problems can be fixed. It will be several days before blood test results will confirm just what type of mange is afflicting Kylie.
There you go.
All right, honey.
Gorgeous.
But for now, this lucky survivor will return to the care of rescuer Sonia.
All right then, honey.
She'll build up the malnourished dog's strength and get Kylie ready for a loving new home.
Say thanks, Riaz.
Bye, gorgeous. You're going to sleep well, aren't you? You'll never forget your first sort of patient, regardless of what it is. I think I'll remember Kylie forever.
All right, honey. Get you some dinner. Check get you some dinner.
Kylie, well done. Look at you. Well done.
Hello, Sonia.
Hi, Scott.
Oh my God, Kylie!
It's been 5 weeks since Scott first met Kylie.
You look incredible.
Doesn't she?
She's an absolute vision, isn't she?
She looks fantastic. Did you recognise her?
Hardly. Well, first of all, she's got hair. Hair
She's
on
like,
the face.
Look at me. Look at me. Her legs.
Hair on the legs. Hair on the tail. Look at that.
Kylie looks absolutely amazing. I can't believe this is the same dog. She looks beautiful.
The blood tests have shown Kylie was under attack from the debilitating sarcoptic mange, better known as fox mange.
So beautiful.
I think what the irony is here is that she had fox mange, and now she looks like a fox.
You look like a fox.
Don't you?
You look like little Foxy.
Hey?
Foxy Kylie. Kylie is just loving the attention and she deserves it. So I say, go Kylie.
It won't be long now before Sonia will reluctantly allow the little Pomeranian to leave her care and go to a forever home.
She's just still there to be loved and to give love.
Beautiful foxy Kylie. Yeah. Good girl.
This exotic-looking dog is a Podenco from Spain. In their homeland, the breed is often treated with shocking cruelty.
They are not considered pets. They are bred purely for hunting rabbits. They're starved because the perception of the hunter is if the dog is starved, it will hunt better. As soon as the season is off, they dispose of them by either throwing them out on the streets or even worse, they throw them down ravines. And unspeakably, they hang them off trees.
Paloma was one of the lucky ones after she was rescued and taken to a Spanish pound. The Podenco was suffering from a broken leg that had never been treated.
I assume the hunter obviously couldn't care less about her health and just let it sit as is. Once realizing that she couldn't hunt, he dumped her.
The lower joint and the upper joint are not affected, but we've got a twisted leg.
A local vet then refractured and straightened Paloma's leg with a metal plate.
I applied to adopt Paloma. As soon as she arrived at the door, she was just delightful, so happy, loving and jumping, and so glad to be here. And it was just wonderful. Are you a happy girl now that you're here?
Paloma is now settling in well to her new English life. But Laura is worried she may still have a problem with her leg.
Lately, there is a slight limp after she runs quite a bit in the park. We're going home. That's why I've contacted Scott. I wanted him to check her over just to make sure there's nothing very serious. Hello, Scott. How are you?
I'm very good, Laura.
Good to see you.
How's our beautiful Spanish princess? Hola!
Well, here she is.
¿Cómo está?
Having a rest.
Bit tender there, you can see.
Concerned.
She's saying, in the nicest possible way, get off, aren't you? Hey? So there's definitely a bit of restriction in the movement of her wrist joint, her carpal joint there. It just doesn't quite go back as far as it should. The old fracture site and where the plate is holding the cut together is just here. I can feel it under the skin, and we can see a little rub mark there where there's actually I can feel a screw underneath. Sometimes hardware like this plate has to come out, and sometimes the body wants to get rid of it. Laura's telling me that Paloma's limp is getting worse, and there could be a lot of reasons for that. It could be a complication to do with the plate itself or residual pain from the original injury that she suffered. And the last thing that poor Paloma needs is more surgery, considering the shocking history that she's had. Can we take a few x-rays of you? Thank you. I'm going to take that as a yes. Hey?
Paloma, where are your manners?
I know. You're a bit of a flirt, aren't you, really? Hey? Come and say hi to Auntie Em.
Hi, Paloma. Hello, how are you?
There we go. Keep her nice and comfy. Yes, because we're going to sedate you and have a look at that leg, aren't we, sweetheart? Let's hope we don't find anything too bad.
I'm just hoping that it's just something that can be fixed with rehab rather than have a major operation again. Oh, Paloma, you're so brave. What a brave girl you are.
Laura adores this dog. She's so protective over her now. I think she just wants her life to be beautiful.
Good girl.
It's quite emotional, actually. I feel very emotional at the moment. She just looks so vulnerable.
Okay, ready?
Okay.
But hopefully everything will be fine.
X-ray. Poor Paloma has been through hell and back. She's had major surgery, and now I'm quite fearful that the plate seems like it could have moved, causing some discomfort. And the worst case scenario is that she might have to go through yet another surgery. What we can see is very clearly where the old fracture was. So this is where whatever horrible thing had happened to her, that's the damage caused.
The question is whether the plate used to repair it has moved and will need to be surgically removed.
Poor girl.
So that's not a particularly attractive fracture site. When I think about everything that Paloma's been through, the terrible neglect and how she coped with what would have been an excruciating injury, it really makes me realise how brave and how dignified this beautiful dog really is.
New owner Laura is anxiously waiting for the results.
Right, so Paloma's doing very well. Emma's just monitoring at the moment, but the x-rays are showing some really good news, actually. The fracture site, although it's not particularly attractive, it's healing, it's doing the job, and the plate is also doing its job, so that's not the problem. But what I have found is that there is some tightness in the ligaments to the foot. During the time that she was injured, the ligaments of her wrists have contracted
like that, because she lifted her leg off the ground for who knows how long until that healed. And as a result, now she's trying to run normally and have all the flexibility you would normally expect from those ligaments, and it's just not there. So the key treatments that we need to consider is laser therapy. Now, I know that sounds a bit out there, but it can work really well in these cases. So alongside physio, which will increase the flexibility of that joint. Okay, so no surgery needed. That's great news, but there's still a huge amount of work to be done to make sure that Paloma's leg moves freely. But I know she's got an incredible owner in Lara who's very dedicated, very determined to stick to the plan to make sure that her beautiful dog leads a pain-free future. And now we just need to give her a bit of therapy, a bit of love, and I'm sure she's going to come right.
That's a relief.
Yeah.
That's a real big relief.
Yeah.
Just 2 days after Paloma's x-rays, Laura has not wasted any time organising cutting-edge treatment to ease the stiffness in her Podenco's leg.
Hello, Lara. How are you?
How are you?
How's our girl?
Not bad, not bad.
Okay, well, now we're going to up the ante a little bit with laser therapy.
Oh, wonderful.
All right, I'll take her off your hands
Thank
and I'll
you so much.
see you later.
Okay.
Cheers.
Thank
Bye.
you.
Come on,
Thanks
gorgeous.
a lot. Bye-bye.
Good girl. Laser therapy is fantastic for Paloma because it'll help her to break down any scar tissue that might be present in the leg, but at the same time it reduces inflammation, it can reduce pain, and it stimulates cell formation and regeneration. All great things when you've suffered with a chronic injury. Here we go. To Leah. So if you just give her a little hold there.
Receptionist Leah is going to help Scott during the laser session.
It does need 2 people, and those 2 people need some crazy glasses, and Leah was more than happy to try some on.
I think I'm going to go for the middle ones.
Really?
Yes, please.
Surprising. Builds a chic.
I know, bigger the better. How do I look?
You look like you're about to do a spot of welding.
Well, I'm a woman of many talents.
I bet you are. All right, I'm going to sort of go for like triathlon style. What do you think?
Excellent, it just works.
Thank you, Leah. What do you think, Paloma? Do I look like a plank? Hey? Yeah? All right, let's just sort your laser out now, shall we? So what we're going to be doing is just using this little machine, and what we're going to be doing is for about 6 minutes just putting a laser onto her leg.
So can she feel any of that?
She might feel a little bit of tingling, and she might feel a little bit of warmth as well.
Okay.
But you don't seem to be bothered by that, do you, sweetie? Hmm?
You are good. You're being such a good girl. You are. It was my first time seeing the laser machine. I'm actually surprised how sort of gentle it was and didn't really affect Paloma in the slightest. It was really good.
Hopefully what it's going to do, more importantly, is just try and heal and improve any scar tissue that might be present. Just get a little bit more flexibility in this joint so you can run like a gazelle. That's what we want, isn't it?
Hey.
There you go, Paloma. That wasn't too bad, was it? Hey, wasn't too bad. The fashion wasn't bad either. Hey.
Come on.
Hi, Laura. Good to see you.
And you. Mwah.
Hello, beautiful Paloma. Ignoring me.
She's too busy having fun.
As for Paloma, after weeks of laser treatment and physio, the Podenco's leg is much improved.
She does really seem to be walking brilliantly well.
Oh, yeah, totally. She runs. I haven't seen a limb.
Paloma's looking fantastic. She seems so comfortable. She seems to be running so beautifully well. And it does seem that all the hard work that Laura's put in with regards to the physiotherapy alongside the laser has really made a difference.
Yeah, absolutely. She's loving life. Has lots of friends, and she loves the park so much. It's hard for me to get her to come home.
Hello, baby. Hello, gorgeous. Good girl.
Paloma is very grateful to have been saved, and she shows me every day through love, affection, and sometimes mischievousness, but that means that she's feeling at home and safe. And obviously that makes me very happy.
I really admire Laura's passion for animal justice. When she heard about the plight of Spanish Podencos, she didn't just stand by, she did something to help. This woman is a real rescue warrior, and I feel privileged to be able to have helped her with her cause. Well, Lara, I'm so proud of what you've managed to achieve with this dog, and she's looking great. She's running well. She's got lots of friends, and she's got a loving owner. So what else can we ask for?
And I'm proud of you.
Well, thank you. Let's hug it out.
Oh.
Hello, buddy. This is Jimmy. He's come from a hoarding situation and he's got a big problem with his hind legs.
Jimmy was found locked up in a small cage, covered in his own excrement. The 3-year-old Border Collie had been forced to spend his life in a crouched position, unable to stand up.
And how long do you think he was there for?
I think he was born there. I don't know, but I think he was. Yeah.
Jimmy. I've had the misfortune of seeing quite a number of cruelty cases in my career.
That's a good boy.
But Jimmy was off the scale when it came to just plain neglect. This dog was left in a cage pretty much to rot.
Come on, Jim. Good boy. Good boy.
I think what angers me the most when it comes to animal cruelty is that these are innocent creatures that haven't asked to be owned by these horrendous people. They haven't deserved what's happened to them, and it makes me want to defend them, and defend them I will.
Come on.
You know what he walks like? He walks like he's on hot coals, doesn't he? Like he's right up on his toes, like walking really, really gingerly.
Yeah.
The left leg is definitely weaker than the right. You can see he's actually lifting that one up. Poor guy.
I actually think I'm getting worse as I get older at coping with it because emotionally it's draining. There's hardly a day goes by that I don't shed tears over these dogs.
All right then, let's pop you in the back of the car. We'll go and see Michael.
Scott has made an appointment for Jimmy with specialist orthopaedic surgeon Michael Hamilton.
I think Jill has already developed a really strong bond with Jimmy. She really has a soft spot for him, you can tell. And I know that it's really worrying for her.
Good boy.
He is going to need a lot of complex work, and she knows that.
See you soon, Jimmy.
So, of course, she's very nervous about me taking him, but I know she trusts my judgment, and I am really taking him to the best place possible.
Hello, mate.
Hey, Scott. How's things, all right?
Great to see you.
Yeah, you
Very
too.
good.
You too.
So let me show you a very special patient. This is Jimmy. He was rescued from a place where he was basically kept in a crate his entire life.
Oh, no way.
And when they found him, he was absolutely covered in his own fecal matter to the point where they had to shear him like a sheep. And now he's got this very strange curved sort of spine, and his knees feel terrible.
2 big swollen knees. Do they move much? Oh dear.
I know Michael very well. When he's looking at Jimmy, I can see that he is pretty shocked.
Crikey, this knee is just something else, isn't it? God, you can just feel it grating. That is not very nice at all. As you move those knees around, it's bone on bone, and it grates and it crunches, and it's just horrible. Oh, no, man.
You won't be impressed. Just see, he's real tucked up, isn't he?
Carrying that back left, isn't he? He's been very brave, isn't he? Both those knees, particularly the left side, they're toast. There's nothing you can do. There's going to be no cartilage in those knees. They don't move very much. They've got to be painful. Okay, so we'll just have to step outside, get x-rays.
The extent of the problem becomes even clearer on the x-rays.
Straight away, that does not look very nice at all.
It's terrible.
Sclerosis here, effusion here. So that is horrible. They would make it onto the rostrum of the worst knees ever, yes. Knee replacement would be the best option. If it goes well, that's the best option for the dog, no question. The other option, which we can do if a knee replacement didn't go right, the other salvage option is to just fuse it, get the dog out of discomfort.
Good boy.
He's just the nicest dog, isn't he? And he's had a hell of a time by the sound of things. We can certainly help him out, and fusion, knee replacement, they're the options.
Michael, great to see you as always.
No
Thanks so
worries,
much for your
no
help
worries.
and advice.
Yeah,
and I
of
will
course.
pass all that on to Jill,
Yeah,
and
of course.
I'm sure she'll be in touch very soon.
Yeah, sure.
Okay.
Yeah.
Cheers. See ya.
Oh, good saying, hello, Jimmy, welcome. You're such a good boy. Yes, is this fun?
For the first time in a life of neglect and cruelty, the 3-year-old Border Collie is finally surrounded by love.
It must seem to him very strange, the fact that people are being kind to him. I think he's becoming happier every day. Jimmy's temperament is wonderful. He has never, ever growled or snapped, which is amazing. Good boy. Maybe he knows we're going to help him, I don't know, but he's a wonderful little dog.
Hi,
Jill.
Hi,
Scott.
How are you?
I'm fine, thank you. Aw.
Good to see you.
Yeah, come in, I've got you a cup of
Oh,
tea.
lovely, thank you.
Later that day, Scott arrives to take Jimmy for his major surgery. But first, he wants to reassure Jill.
Someone looks comfortable.
Yeah, I think he's made himself at home, don't you?
He really does. Who has got his paws under the table, hey? You have. Unbelievable. Well, I think the procedure that Michael and you have decided to move forward with is a great one because it has far less complications.
Yeah.
So as much as it would have been wonderful to turn him into the bionic dog, what we need to do is turn him into a comfortable dog.
Yeah.
And this procedure is going to do that without breaking the bank and breaking you and meaning you can keep going on with your great work.
Yeah. And really, at the end of the day, all we want is for him to be pain-free. I think it's the right decision. Yeah. I have to be determined for my dogs because I'm the only one they've got.
Oh, you big pudding, hey? Say goodbye to Jill.
Oh.
Say goodbye. Hey?
Hi, Jimmy. Good boy. Their life is in my hands, really. It is, but I wish I could do more. I do. You've got your chair back, Violet. Good girl. Good girl. Good girl.
Right, Jimmy.
The big day has arrived.
Yeah. All right, mate. So, plan is we're going to fuse his knee. The whole point is it's not going to be sore once we're done. That's the whole point.
Yeah, it gives some stability, takes away the pain.
Yeah, exactly. And he's going to be a happier dog.
At the Cherry Tree Veterinary Practice, specialist orthopaedic surgeon Michael Hamilton has started Jimmy's life-changing operation.
It looks horrible.
It's really bizarre.
Crikey, this is a very chronically inflamed knee.
He and Scott are immediately horrified by what they find.
I'd say of all the surgeries we've done together, mate, this is by far the most gruesome.
That's horrible, isn't it? Look at that.
Jimmy's knee looked like a bomb had gone off in it. It was horrendous. It was the worst knee I've ever seen. There was virtually nothing normal about it.
First, Michael will trim the ends off Jimmy's bones. Then he'll fuse them together and fix them in place with a metal plate.
When we actually made our cuts in the bone to kind of get flat surface on flat surface, those flat surfaces looked actually quite healthy. That looks pretty darn good to me. That's as straight as his leg's going to go. And then what we do is we put our big plate from up here right the way down over the top down to here, and then we're done.
The plate goes on without a hitch, but Michael is not satisfied.
I was just a little bit unhappy with a single plate.
To keep it in that slightly flexed position and to support that fusion of the knee, Michael then decides that he's going to actually place a second plate over the central part.
There's a couple of here that's just a little bit awkward, but once I get them in, I think we'll be good.
But by doing so, we come up against a few problems.
Because I'm stacking these, they're not quite sitting perfectly on top of one another. As we are putting in the last screws on the second plate, I can't quite get them in because it's not perfectly aligned.
Michael's just throwing everything at it to try and get the best result.
I wasn't overjoyed about that.
Michael wasn't happy, and it meant for a very long procedure.
Sorry, guys, that's kind of changed my mind a little bit. Whether it's active or not, I mean, I think this dog has probably had an infection in this knee. I mean, look at that.
A long-time mate of this dedicated specialist, Scott knows Michael will never settle for second best.
Michael's a perfectionist, so he's not happy with just one plate. He needs this reinforcement plate.
Sorry guys, just a bit of a hitch in the home straight.
Michael fought and fought, but it just wasn't going on. So to then, after all that work and all those hours of surgery, to remove that second plate, that was fraught. It didn't go down very well. You want to get it absolutely right.
Yeah.
Even if it does drive you a little bit crazy.
Yes. So we took off the second plate, put the first one on really, really nicely, and put another little plate down the side. That was the right thing to do, and it should go nowhere. So I'm really happy with it. The thing that I'm very proud of is that I didn't just go, oh, it'll do, because it'll do sometimes doesn't do. And that's not what I'm about. We want it to work. Perfectionist, possibly, yeah. Overkill, possibly, but I'll sleep a bit easier tonight, and hopefully Jimmy will as well.
So finally, even Michael is happy with his work. But the operation has run 2 hours over time, and the surgeon is running late for an important meeting.
My wife is going to kill me.
Yeah. Good boy.
But no one's going anywhere until X-rays confirm the surgery has been a success.
So that's a straight-on view of his ankle, that's a straight-on view of a hip joint, and that's a straight-on view of a knee. So I mean, that's a perfectly straight leg. It looks great. Really pleased with that.
Just call Jill soon, hey? Call Mummy. Tell her everything's gone well. A very long surgery, but that knee has been fused within an inch of its life, hasn't it? Yes, it has. This is the start of a good new life for you, eh?
Well, I think this is one contented pooch. What do you think?
Isn't it just? Yeah. Amazing.
Scott has dropped in on Jill to check on Jimmy's progress.
He's so much happier in himself. It's just incredible that we've been able to do this for him.
Come on, let's see how you're going. Good boy.
The surgery is a success. Yes, it's a salvage procedure. He has a knee that's now fused, but the pain is gone. And that was the whole point of this, to give him a nice pain-free life and allow him to enjoy himself for the first time in his life.
What's his future hold?
Well, we have a wonderful home lined up for him. She's a wonderful person. She's very patient and caring and...
Everything Jimmy deserves.
Yeah.
He's going to be adored for the rest of his life, and I know that's absolutely what he deserves. It's been such a great journey, and a great journey with you as well.
Yeah.
Until the next time we've got another sad case we have to fix, eh? And then the dream team will be back together again.
Yeah,
eh?
I hope so.
Cheers.
Cheers.
Cheers. Cheers, Jim.
Ma, so who is this?
This is Mia.
Hello, Mia. Aren't you a pretty girl?
And this is her little brother, Ted.
Jill's 2 new rescue cases are 7-month-old siblings. Ted and Mia were found emaciated and riddled with worms. But it's the little boy's lame back legs that are Jill's main concern.
Such sad dogs arrive here sometimes, and although sometimes it takes a long time, it's wonderful to see them recovering and the light coming back into their eyes. That's, I suppose, why I keep doing it.
Okay, Jill, so I need to see your little boy do a bit of walking. Okay. So do you want to walk over that way?
Come on, Ted.
Go on then, Ted.
Come on. Good boy.
It's not normal at all. He's very stiff on that back leg, isn't he?
Yeah, it's not right, is it?
It really is a very concerning moment when a young dog is lame and limping on a hip that should be completely healthy. They should be bounding around, and he isn't. And that really worries me for his future. Okay, I'm just going to extend this hip here.
Yeah.
Good boy. There's definitely something going on in this left hip.
Yeah.
There's a bit of clicking. He definitely resents me extending that hip. Ooh, does it hurt a little bit? Eh? For a young dog of his age, you know, he should have very flexible, very mobile hips, and this one, there's definitely some tightness. So I think that's probably the cause for his lameness at the moment. It's painful, he can't fully extend it, and in the worst case scenario, it could be something like hip dysplasia, where the hip just falls out of the socket. So
what I think we need to do is take this young man to go and see my mate Michael, the orthopaedic surgeon, get him to have a little look. We'll do some examinations, likely x-rays, and look a little bit deeper into what the problems are.
Well, as long as we can do something.
Yeah, here we are again.
Yeah. The news Scott usually brings to me is that something is going to need major surgery and cost thousands of pounds that we haven't got. But even so, we always manage to find it. So no dog ever goes without treatment if it needs it.
Okay. Get you into the car, hey? Go see Michael.
Ted's been through so much, had such a terrible start to his life.
Say bye, Jill. Hey.
Hi, Ted. Good boy. And hopefully, if we get some good news today, he'll get into a loving home of his own.
That's it. Lovely. Good boy.
Near Marlow in Buckinghamshire, Scott has arrived to ask orthopaedic specialist surgeon Michael Hamilton to check out Ted the rescue pup.
I know, it's a Geordie. I know. It is a bit off-putting. Come on.
But the 7-month-old is definitely nervous about seeing his second vet of the day.
Come on. In you come. Come on. Oh, you're going to make me carry you, aren't you? Come here. Come on. Sleep. Come on. Hello, mate.
Hello, mate. Good to see you.
And you, and you. So this is Ted.
Yeah.
He's from Ireland. How's your Irish accent?
Poor.
Yeah.
Poor. Fairly poor.
Me too, me too. I can drink a Guinness and that's about it. This guy, he is walking quite oddly on his back leg, on his back left. Today is a massive crossroads for Ted's life. It could just be that he has a slightly tight hip, that's a muscular issue that will resolve with physiotherapy or hydrotherapy.
Yeah, he's getting a bit tense there.
Or it could be as bad as a hip needing a total hip replacement. There's a massive spectrum there. We need to find out where on that spectrum he is.
Right, OK. Right,
Come on,
mate,
Ted.
Let's go.
Let's go for a run.
Go on,
Good
Ted.
boy. Come on, then.
To further assess Ted's hips, Michael needs to put him through his paces.
Good boy. That's it.
So the reason we've come out here is we need to see him at a faster speed and then ideally in a nice straight line. And this works perfectly. This little runway number 1.
Keep going. Good boy.
Yeah.
Good boy.
Go on, keep going, Scotty.
Say good boy.
And a bit quicker.
Good boy. Hope you don't find anything wrong with me.
Come on, Ted. He's got what I call the supermodel swagger. So as he moves, rather than kind of pulling his hip through, he swings his whole pelvis forward. So he kind of walks like he's got a pair of Christian Louboutins on. Let's X-ray his hips. Let's see how good or bad his hips actually are.
Ted's swagger could be the result of poor diet or a lack of exercise, but the main reason why young dogs like him walk like he does is a condition called hip dysplasia. That's where the ball literally falls out of the hip socket joint over time, and that causes painful rubbing of the joint.
X-rays.
If that's the case, Ted could need a total hip replacement. Now, that's major surgery requiring weeks of rehab.
These X-rays will give Michael and Scott the answers and decide Ted's future.
So this is an X-ray of his hips. So these are the balls of the ball and socket joints. The balls are basically sitting quite well in the sockets. Yeah, I mean, his hips are actually pretty good. I guess he could still snatch defeat from the jaws of victory, but you know, they're pretty good. So I'm really glad we did that. I can only assume that some of his muscles and some of the soft tissues are just tight, probably because he's had no exercise, he's had a poor diet, etc. But from a surgical perspective, there's nothing for me to do. There's nothing, no tendons to cut, no joints to replace, no broken bones to fix. So I think he's going to be fine. I think he's going to be fine. I'd be very surprised now, based on that X-ray, if he needs any intervention ever. So that's really good news for him. As he just does more and more exercise and becomes more and more of an athlete and gets a good diet, he's going to be normal.
Hello. That was a good little wake-up, wasn't it? Hey, lots of good news to tell you.
I think it's great news for Jill today. I think it's the chance that she can now find a forever home for this beautiful little dog, give him the future that he's looking for, and we'll keep a close eye on him to make sure that he does reach his full potential. All right then, mate. Well, thanks very much.
No problem.
Yeah, Ted says thanks very much.
Yeah.
While Ted is still looking distinctly worried,
Good to see you, mate.
See ya. Take
All the
care.
best, yeah.
Bye.
Scott can't wait to deliver the shy puppy back to Jill and give her the news she's been hoping for.
So it's
Oh.
rare, Jill, that I get to speak to you about good news.
Oh, that's good.
Yeah. The X-rays actually show that his hips are relatively good.
I was really nervous about what you were going to be saying to me. So it's really good news, isn't it?
So I think what we need to do is to allow him to grow, but also in an environment which is healthy, which is going to get good food, therefore good nutrition, and also exercise, which is absolutely key to develop physically as he should.
Yeah.
And my hope is that the lameness that he's showing at the moment will come right once he's just using his body the way it was intended.
Scott has given me the most amazing news. It is just a case of bad nutrition and neglect. So with care and love, he should recover well and hopefully be rehome soon.
I think if he was one of the 7 dwarfs, this guy, I wonder if would he be dopey or sleepy?
Don't say that. He'll never get home.
Good luck finding that new home, mate. You deserve it. Good boy. Yeah. Good boy. You love me, don't you? Yeah, you love me. Here you are. Yeah.
You gonna spin? Good boy.
As for Ted, all his Christmases have come early. He's found the perfect forever home with Border Collie lovers Dorian and Kim, and their other rescue dog, Kenny.
Oh, good boy. Good boy.
It's been a long journey for both Ted and Dorian, but this Christmas promises to be a very happy one for them all.
Good boy, Teddy.
Today, it's Jill's latest arrival, Malala, that she's so concerned about.
I've rescued her from a farm. She's obviously a very poorly puppy. Hey, keep still.
The little Border Collie is badly malnourished and is also struggling to control her head and body.
Hi, Scott.
Oh, my goodness. This is a little one for you, isn't it? Hello, baby. Oh, my goodness. You're so cute. Oh, dear. Wow, she's very floppy, isn't she?
I think she's lucky she's alive, actually.
You've decided to rescue her, haven't you?
Yeah. I just want to shower her with love, really, because she's such a pathetic little thing. And she would definitely have died where she was. Bless her heart. So I'm hoping that Scott will be able to do something for her. It's okay, baby girl. It's okay.
As soon as he examines the little pup, Scott immediately suspects another serious issue.
What seems to be the problem here is that you look blind to me.
Yeah, but she doesn't matter if she's blind.
It doesn't matter. My first impressions of this puppy are not good.
Come on, darling.
Honey.
Hey, good girl.
Oh, my goodness. She's just the definition of neglect. She's very thin, but the most concerning thing is she seems to have this very strange sort of head tilting that's going like this.
Hey, good girl.
She definitely has an abnormal gait. The way she's walking is very stumbly, and she's unable to keep her balance.
Come on. Oopsie.
Oh dear, did I leave my box
Come
in the
here.
way? Sorry, baby. She simply cannot control her own body movements. She's not got just a few issues. There's a lot of issues here. This hip is feeling really quite weird. It's very stiff, swollen joints.
I think she's twisted. Oh, come on. It's all right, sweetheart.
Oh, baby. Oh, dear.
The little pup's swollen joints are obviously painful, so Scott will now take her back to the practice so she can be sedated and given a more thorough examination.
This puppy is in such a terrible state. I am really, really worried about her future. Honey, come on. It's all right. You're safe now. Come on, you're safe now. This is Malala.
Oh,
Short.
Lala.
Lala for
Hello.
short.
Lala.
Yes.
Hi, Lala.
Say
You're wiggly.
They're met by concerned nurses Gemma and Sam.
Are you wiggly? Oh, what's wrong
She's
with
got a head
her?
tilt.
She's got a little head tilt, and she's also got these very, very lumpy joints, which we're going to look into today. But the saddest thing is that she's actually blind.
Oh, no, Lala. Oh, she tried to talk to me. Oh, hi.
Hello.
Seeing the girls lavish Malala with all their love and attention, it's just so beautifully heartwarming to see. Lala.
She wants Auntie Gemma, not Uncle Scott.
Come on then, unhand. Come back to Scott. Come on, beautiful. Okay. Come on then, Sam. Let's get cracking. What I need to do now is do a barrage of tests to work out what the problems are caused by and if there's anything I can do to help this little puppy and help to improve her future.
Oh, good girl. It's all right, it's all right. Good girl.
Given little Lala a sedation in order to take some x-rays, but also to be able to look properly into her eyes, do everything I need to do, it's best that she's a little bit sleepier than she is right now. Come on. Let's have a look at some of those joints, shall we?
First up, Scott is x-raying Malala's legs.
X-ray. Right, Sam, so you can see how white some of these bones are here, and yet how almost translucent they are in other places. So this dog hasn't had enough calcium. That very much suggests the old school disease of rickets. Rickets is caused by malnutrition, and for Malala to have such a severe case at such a young age, you can just imagine what sort of appalling diet this poor puppy's had. Her bones can easily break and literally tiny little microfractures develop just so easily because they're so brittle.
It's just so sad that it could have been prevented.
Yeah.
Rickets is caused by a lack of vitamin D, but fortunately with proper nutrition, the condition can be cured. But the little dog's vision loss and severe imbalance are far more complicated.
This case is really challenging on so many levels. Malala's got so many different symptoms that could be caused by so many different things, and also her early part of her life we don't know anything about.
What I should normally see in the back of this eye is a beautiful carpet of kind of greens and yellows, but what I can see here is just shades of grey, and I can see them in both eyes.
With a growing suspicion that Malala's blindness and imbalance might be connected, Scott is hoping blood tests will provide some answers.
So I'm taking some blood to test Malala for a couple of things. First of all, there's a few parasites that can affect the nervous system of a young dog and also cause them to be blind. I'm particularly concerned about Neospora. It's a certain type of parasite, a protozoan, that can be present in cattle, and then dogs can get it, and it's very bad news, particularly in puppies.
Should we get some food? What's in here?
The results of the blood tests will take several days, but Malala's rickets treatment can begin straight away with some nutritious food.
The good news is that with good nutrition, we should see this puppy much more comfortable.
Don't gulp it down too quickly. Gives her bellyache.
Scott is also planning to take Malala to an eye specialist to see if anything can be done to restore her sight.
She has literally captured the hearts of every single person at the practices. She means so much to us now, and we're really hoping that this little dog is going to pull through and live a happy, healthy life.
Oh, excuse you. That's what happens when you eat your food too fast, isn't it?
Come on then. Let's go and see that eye doctor. Hey? Yeah, let's go and see the eye doctor. Sounds scary, but it won't be. She's very nice.
Next day, Scott has arrived at the Royal Veterinary Hospital with Malala, hoping for a miracle for the little rescue pup. He's meeting ophthalmologist Marian Matas-Riera.
Hello.
How are you?
Good, thank
and you. Very well. More importantly, this is Malala.
Hello, Malala. Shall we have a look at you, my love, see what we can do for you? So do you want to come to the concert room?
Yes, please.
Yeah,
Lovely.
Let's go.
Gorgeous. It might be unrealistic, but I'm just hoping that Mariam will find something that we can do to help treat Malala's blindness.
So what we'll do now is we're gonna dilate her pupils so we can have a good look at the back of her eye. Hey, puppet. Good girlie.
Drops. This puppy is so gorgeous. She's had such a tough start in life, and now I just want the best for her, and hopefully that means vision.
So I know I look like Darth Vader now with this, but the aim to use this instrument is so it allows me to look at the retina, so at the back of her eye. Okay, Lala. You gonna let me do this? Yes, good girl.
I know. Good girl. Darth Vader is scary. Yeah.
This is very important, my love. This is very, very important, puppet.
Good girl.
Good girlie, my love. Good girl. There we go. Good girl.
Well done, baby girl.
Okay, so her retinas are not good. Her retinas are really severely damaged.
The prognosis is not looking good for Malala.
Her retina is really unhealthy. There's no blood vessels at all, and that is quite shiny, which tells me that is really abnormal. So it's really has degenerated to the point that is nearly atrophied. And that's not good news because it's not a tissue that we can make it regenerate. Once it goes, it goes.
Oh dear. Oh dear. That's no good, is it? Hey, that's no good.
The changes present in her eye are something that you don't see very often in puppies, and it does mean that Malala will never regain her vision.
Oh, wow.
Good girl. Where's Scotty?
Dan?
Where's Scotty? Come here.
Despite her blindness, Malala is young enough to be taught to follow voices and the sounds of footsteps to help her get around safely.
Well done. Oh, you're so clever.
Finding exactly what's caused the puppy's blindness and her balance problems is the next big challenge. Scott is pinning his hopes on the blood test results for some answers.
Oh, what a good puppy.
Oh, fantastic.
At Scott's Richmond practice, rescue pup Malala's blood test results are now in.
Toxoplasma. Negative. Excellent. Very good.
Scott is hoping to find out why the young dog is blind and struggling with her balance. He suspects a dangerous parasite called Neospora could be the reason.
Neospora. More than 1,600. I'm totally shocked. The results are in and the Neospora level is just through the roof. So she has definitely been exposed to this disease.
Neospora is a potentially fatal parasite that attacks an animal's brain and spinal cord, gradually shutting down their body.
Gutting.
Most of the time, puppies or dogs that get Neospora end up dying from it. It's a nasty condition. It causes all sorts of things from ascending paralysis where they just get weaker and weaker. They can't eat. They have liver problems. They have breathing problems. They have muscular spasms. It's a horrendous condition.
Oh, good girl. Is that nice?
The little pup is waiting upstairs with Nurse Sam and receptionist Kirsty.
Hi, guys.
Scott.
Hey, yeah.
Teaching her a few tricks.
Oh, yeah?
She's doing very well. Very well.
Good. Well, I'm sorry to be the deliverer of bad news, but unfortunately I've just got the blood results back and she's got Neospora, which is pretty bad. So it basically means that she does have neosporosis, the clinical disease, and unfortunately at any point she could deteriorate badly. And we're talking paralysis, we're talking unable to walk and swallow and liver problems, breathing problems. It's hideous.
Malala will be started on a course of antibiotics immediately to hopefully wipe out the parasite. She now has a tough battle ahead of her as her body tries to fight the disease.
I'm so sad. Just seems to be one thing after another that we keep finding. It's not fair, is it?
I'm willing with every part of my being that this beautiful little dog gets through okay. Such a good girl. Hey. Yeah, that nasty Neospora isn't going to get you, is it? No. No. Hey, you're so nice. Hey. Hi, Jill.
Oh, hello,
I've got
Scott.
your baby.
Oh, Malala. Hello, darling. Hello.
The young pup is finally well enough to be reunited with her devoted carer, Jill.
You home? Yes, you're home.
It's always a wonderful feeling to come back and see Jill, but even better when you can reunite her with her baby, Malala. Malala's just such a beautiful little dog, and she's so plucky and tenacious that I'm sure that Jill missed her a lot.
You home?
Scott has been treating Malala for 6 weeks for a deadly parasite that has left her blind and attacks the brain and spinal cord.
Good girl.
For now, antibiotics seem to be keeping the problem at bay, but she's not out of the woods and needs to be closely monitored for the next few months.
What it means is that Malala is under a bit of a dark cloud. At any point when her immune system is weakened, all the clinical signs that we saw right at the start can happen again. She's on the right medication to protect her from getting any worse at the moment.
Yeah.
We need to make sure she's as healthy as possible, as stress-free as possible, to keep her immune system as strong, to keep fighting the disease, because if she can get to her first birthday party, her prognosis improves dramatically. Research has shown that if a puppy gets to their first birthday, there's a much better chance that they actually don't have the disease that will linger long term, which should mean that if she gets to that first birthday, life is good.
Well, I'm glad she came to me anyway, because she wouldn't be here now, probably.
Oh, without doubt, Jill. And I know that you're the one that will help her through this.
Oh, I will. I will. Won't we, Malala? We all will, because we love you, don't we? Yes, we do. She's got to get better for all of us. She's too much loved for anything to happen to her. We'll just fight it together.
Should we show Mummy the dance? Hey? Should we show Mummy the dance? Lala, ready? Lala. Lala, come. Oh, she's making me look like a fool. Lala, good. What are you not dancing? Malala and I decided at the clinic that we were going to perform a little dance routine to perform at her first birthday party. Lala, come. Come on. I worked out that she would follow the tap of my feet and then she would dance around me. Lala, spin. Oh, my goodness.
She says, why are you doing that?
I know. But as soon as we get to Jill's place, she leaves me hanging. I'm dancing around like a lunatic, but at least Jill found it funny.
No,
Here we go.
That's it.
Here we go. Through the legs. Through the legs. Yay! Good girl.
There's room for improvement there, I think, but Malala did well.
That's a good girl. That's it.